So, my disability is a chronic back pain, anxiety, PTSD, um, a hip fracture, a benign hip fracture, and a partially calcified kidney that produces kidney stones. Um, the disability affects my daily living with my back. If I drop something, and sometimes when I bend over to get it, my back locks up, or it just doesn't do what it's supposed to do, and it hurts for the rest of the day. I've hurt myself picking up a t-shirt, or trying to lift laundry basket. The hip, when I sit, especially in the car, if I have to go to one of my appointments, some of my appointments are over an hour away. If I'm in the car for a while, it makes my walk a little funny. It's nothing too terrible, but it's definitely tender and sore, enough for people to notice. The kidney problem, mostly just I have to make sure that I get a lot of water in, and that helps me not get the kidney stones, which are quite painful. The anxiety and the PTSD, those I would say, along with the chronic back problem, are my main problems with my daily activities. The PTSD causes the anxiety, and the nightmares. Sometimes I'll get maybe 2 hours of sleep a night. Sometimes, I'm up every 3 to 4 hours, wide awake, can't go back to sleep because I've had a bad dream. The PTSD makes it hard, and the anxiety make it hard for me to be in large crowds of people, loud noises, alarms, just overall any kind of, sometimes if someone's volume on their phone is too loud, it like startles me for a second. Just that unexpected noise. The nightmares, obviously, if I'm not sleeping, the just next day I am exhausted and a little irritable. My doctor is going to be giving me new medicine. I was diagnosed with latent tuberculosis, which they believe I got in Afghanistan, and the antibiotics I'm taking for that counteracted the medicine for the depression and the anxiety. So we're changing the medicine, and he's also giving me a new medicine to help my brain kind of shut down at night, to try and stop the nightmares. There's like a 1% chance it'll work. I would say the biggest problem with the nightmares are that I struggle waking up from them. I'm in them, I'm aware that I'm in them, but I just can't wake myself up. And my boyfriend helps me sometimes now that I'm staying with him, and sometimes he works at night. Sometimes I'll get myself awake, and I'll either be wide awake from the nightmare, or if I am able to go to sleep after. The other problem I have is that no amount of time, give it 5 minutes to 2 hours, I sometimes will go back into the same exact nightmare, and that just kind of sets a tone for the whole day, where it's like I can't stop thinking about the dream. They're very vivid and very realistic. There are times where I've woke up from them and had to like kind of gather my surroundings and figure out if in fact what happened in the dream really did happen, or if it was just a dream. My typical week, unfortunately, I don't have a set schedule right now. My appointments kind of dictate what my week looks like. I'm doing school online, but I'll have to go to the campus every now and then to take proctored exams, or there's a couple exams I'm going to try and take so that I can skip some classes. But between school and my appointments, which my therapy is once a week, and I'm about to start that up again after moving, my school is very flexible, which is nice, because of all the appointments that I do have to have. So at any given time, I could be every day of the week going out to an appointment, or I could be home every day of the week, minus the one for therapy. And that's usually anywhere between 20 to 30 minutes to get there, sometimes an hour, depending on traffic, an hour there, and then possibly up to an hour back. And then the rest of the week, I am at home doing schoolwork. Obviously, if I have to go to the grocery store or any variation of that, but my weeks are very spontaneous with in regards of like, oh, I've got to go to the grocery store, or oh, I've got to run out and get supplies for school. Luckily, my appointments are pretty far in advance. I try to book all of them about a month out, so I'll have 4 weeks of therapy already planned out. Obviously, with my psychiatrist, I go and see him once a month. My primary care, anywhere between 2 months to 6 months, depending on any issues I'm having. But my weeks, I don't have a typical week, if anyone does. I'm not working right now. Once I start working, my appointments will be in the evenings, and I'll go to work and then to any appointments I need in the evening after that. I don't really have any activities that I participate in. My daughter would be taking piano, and that's about it, and that's usually just sitting in a waiting area. I'll have to go to campus every now and then. Obviously, that environment could change, where it could be loud, or if I'm in the exam setting, it could be quiet but crowded. There could be a whole room full of people, or there could be 2 or 3 people. So as of right now, that's the only thing I have going on. With work or with school, eventually I'll have to be doing an internship. So obviously that environment, sometimes it's remote from home, and sometimes I have to be in an office setting. But other than that, I don't really have any out of the ordinary activities that I will be partaking in.